coalition of student leaders and advocates, AB 602. Right now, across California's public colleges and universities, students are facing disciplinary action for doing the right thing, protecting themselves, protecting their friends, protecting their fellow students is not something that young people or anyone should ever be punished for. Right now, if a young person on a campus is experiencing or witnessing a medical emergency related to a drug overdose, one of the most dangerous and deadly things that can happen to anyone, they can be punished for simply calling for help. Under current policy, students may be placed on academic probation, suspended or permanently documented in disciplinary files simply for being under the influence or present when an overdose occurs. These consequences can affect students' livelihoods, their ability to graduate, to transfer, to work jobs on campuses, or to pursue certain careers. Fear of academic punishment often deters students from doing the right thing, calling 911, or administering naloxone during an overdose. This is critical life-saving care where the difference of seconds or minutes can determine whether somebody is able to survive a deadly drug overdose. California's Good Samaritan law already protects people from arrest or prosecution when they call for help during a medical emergency related to overdoses. But those protections do not currently extend to discipline on campuses. UC, CSU, and the community colleges in California all have different policies as it relates to punishment of students for doing the right thing and calling for help. Some campuses actually have automatic sanctions or mandate drug testing, even for bystanders. Others offer limited amnesty protections that don't cover certain types of overdoses, and the result is this confusing and inconsistent system that discourages students from taking life-saving actions. We know that we have a crisis, an epidemic of drug overdoses in our state. Over 7,000 people last year lost their lives to opioid-related drug overdoses. This is a number that has doubled in the last 5 years, and it is a number that has gone up even more rapidly among young people ages 15 to 24. We have to ensure that people can do the right thing, call for help, get help without fearing that they're going to be punished for it. Fentanyl, in particular, is often found in other substances unknowingly. So some students may be actually experiencing a poisoning, and yet when they call for help, they experience punishment for it. It's dangerous, it's wrong, it's unfair. We should be teaching people to do the right thing, and we should also be putting in place policies that will protect students and will save lives. I want to invite a student who had a first-hand experience with this I think, wrong-headed approach of punishment rather than support, and he sought help and was punished for it. And I really want to thank TJ McGee and also all of the students who brought forward this bill solution. This was a bill that was brought to us by students. We worked together on it. And so I want to invite TJ so that TJ can share their story.
Thank you. Excuse me. I never thought I would overdose in my freshman year dorm. I never imagined I'd be lying on the dorm room floor surrounded by paramedics and my roommates, terrified and ashamed, not just because I almost died, but because I knew the long road that was coming next. After surviving my overdose, instead of being met with care, compassion, or even basic support, I was met with disciplinary action. The institution didn't ask me why I had overdosed or how I was coping. No one directed me to recovery spaces, therapy, academic support, or even basic compassion and human reassurance. The message was clear. I was a problem that needed to be managed, not a student in crisis that needed help. It may be a knee-jerk reaction to blame the student who overdosed. I've heard it before. They made bad choices. They brought this on themselves. They should have known better. But we have to ask ourselves, why is that our first response? Why is weaponizing blame and shame so deeply intertwined in our culture that we have turned our backs on people that are most vulnerable? Why is the burden placed solely on the individual while the institution lacks the very resources that could have prevented this in the first place? Some might be hesitant to blame the university for these occurrences, but if the university is not actively educating our students about harm reduction, not ensuring that there are spaces for our students to go to, not training our staff and housing officials on how to respond to an emergency, how is the university not to blame? How can you say, well, we tried, and still have approximately 1 in 4 young adults aged 18 to 25 who are currently illicit drug users? I still remember it was an RA who responded to me first. I cannot imagine how scared they must have been walking into that room, unsure what to do, seeing a fellow student on the floor. RAs are students as well. Many aren't trained for medical emergencies, and few are adequately prepared for overdose response. That moment where someone's life hangs in the balance should never fall on the shoulders of a peer without proper support. And it's not just RAs. Other housing staff, administrators, campus officials, many of them don't know what to do either. That uncertainty, that lack of training, the silence, it costs lives. I had to find recovery on my own. I had to piece together community support, therapy, and academic guidance like a scavenger hunt through a system that was not built to help students like me, students who are struggling, hurting, and surviving against all odds. It felt like screaming into a void. It was exhausting, and it made me feel like surviving wasn't worth it at all. Recovery at Cal and Overdose at Cal have served as lifelines for students, but they are invisible to so many who may need their support. I know for me, I had no idea who they were until way later in my recovery journey. So why aren't these programs that can literally save lives displayed for students to access? Why aren't these services broadcasted across campus with the same urgency as flu shots or midterm reminders? These aren't luxuries, they are necessities. Even worse, I've seen students punished for helping others. Students who did the right thing, called emergency services for someone overdosing or blacking out, but were hit with academic penalties or disciplinary punishment, housing consequences as well. What kind of message does that send? That it's safer to stay silent than to save a life? That culture of silence is deadly. It doesn't protect us, it kills us. We need to change this. We have to change this. Assembly Bill 602 is a step forward toward compassion. It recognizes that students in crisis need support, not punishment. It increases safeguards for students to seek help for themselves or others. It opens a door for real change in how institutions treat substance use, addiction, and mental health. It isn't just about policy. It's about lives, my friends' lives, my lives, the lives of every student who walks into this campus with substance in their veins and pain in their heart. Please don't let another student suffer in silence. Don't let another overdose end in shame instead of support. Pass AB 602. Make it law. Make it a lifeline. We are not disposable. We are not criminals. We are students. We have dreams, worries, pains, passions, all interwoven within ourselves. We are human beings and we deserve to live. I deserve to live. Thank you.
Thank you, TJ, for sharing and for your courage and leadership. We're very grateful that you're here and you're able to share your story and work with us to ensure that no other students have to go through what you've gone through, and that there is a culture of, as you described it, of silence when it comes to addiction. There is a culture of punishment, and that is dangerous. When people are not able to seek help, when recovery is not widely offered and accessible, when folks don't know where they can go to talk to somebody and that there's a shame around it, it's dangerous. And it's most dangerous in these times of emergency when people's lives are literally, in some cases, hanging in the balance. And there's a fear that shouldn't exist for anyone when they're in a situation that is a medical emergency. This is already recognized in our laws when it comes to punishment criminally. We already have Good Samaritan laws, but the fact that universities and colleges are not practicing what we know to be the best way to protect everyone and their health and safety, I think is dangerous and needs to change right now. I want to introduce our next speaker, one of the sponsors of this bill and doing incredible work around these issues of access to treatment and advocacy for students, Sanvi Arora, who's the executive director of the Youth Power Project.
Good morning, everyone. My name is Sanvi Arora. I'm a student at UC Berkeley, and I'm the executive director of the Youth Power Project, one of the sponsors of this bill alongside the University of California Student Association. And I'm so honored and grateful to be here today to discuss AB 602, California's Good Samaritan legislation for college campuses. This bill addresses a critical gap in our current system, one that forces students to choose between helping a friend in crisis or protecting their own academic future. On campuses across California, including at UC Berkeley, students face a difficult reality. Calling for help during an alcohol or drug-related emergency could result in serious disciplinary action, even for the person making that life-saving call. While California already has a Good Samaritan policy protecting people from criminal charges when seeking emergency help, these protections do not exist to university disciplinary actions. This means that a student who calls 911 for a friend experiencing alcohol poisoning or an overdose might be protected from arrest, but could still face academic probation, loss of housing, or even expulsion. These are powerful deterrents that cost precious minutes or even worse during emergencies where every second counts. This issue goes beyond policy for me. It's deeply personal. When I was 15, I lost one of my closest friends to an overdose. That moment changed my life forever. Since then, I've become acutely aware of how crucial it is to remove any barriers that might prevent someone from seeking help during an emergency. As a student at UC Berkeley, I've seen firsthand how disciplinary consequences create dangerous hesitations in crisis situations. The reality is that students calculate these risks even in emergencies, weighing their academic future, their access to housing, against getting help for a friend. No one should have to make that calculation when their peers' life or their own life hangs in the balance. We're seeing alarming increases across the country in suicide rates amongst young people, with suicide being the leading cause of death amongst adolescents. Mental health emergencies, especially those involving substances, require immediate intervention. Every barrier that we place between a student in crisis and potential help puts additional lives at risk. California has already made significant investments in increasing Narcan availability in schools, recognizing the urgency of the opioid crisis. But this life-saving resource remains underutilized when students fear the consequences of reaching out for help. What good is having Narcan available if students are afraid to use it because they're punished for it? We talk a lot about destigmatizing mental health challenges and substance use disorders. We hold awareness weeks. We put up posters telling students it's okay to ask for help. But without concrete policy changes like AB 602, these efforts amount to little more than empty promises. We're telling students it's okay to open up about struggle while simultaneously punishing them when they or their friends need emergency assistance. Real destigmatization requires real change. It's not enough to normalize talking about struggle. We need to normalize helping each other through it and reaching out for help. AB 602 represents that kind of meaningful change, aligning our policies with our stated values of community well-being and community support. Thank you, Assemblymember Haney, for championing this necessary bill. I strongly urge that this bill passes. Thank you.
Thank you. Thank you so much for those words and also for your leadership and courage in sharing. Very, very well said. I want to introduce our last speaker, who is the other sponsor of this legislation and the president of the UC Student Association, Aditi Hariharan.
Hi, my name is Aditi, and I'm the president of the UC Student Association, which serves as the official representative for all undergraduate UC students across the 9 undergrad campuses. Every person deserves dignity and respect, and that is the purpose of Assembly Bill 602. Asking for help can often be one of the most difficult things a person does because it involves acknowledging that there's a problem that is significantly impeding one's life, and it also recognizes that you have to be vulnerable in a way that allows you to get help for your life, especially for something like substance use and substance overdose, which is highly stigmatized and highly policed. There are even more barriers for seeking help, especially for BIPOC folks. There's barriers that involve police involvement and police presence. And folks deserve dignity and understanding rather than the stress of navigating police accountability procedures that don't understand the difficulty and pressure of reaching out for help. University sanctions or police actions are often a huge barrier for students from reaching out, even if a life-threatening situation occurs. In order to remove this barrier, AB 602 asks for no disciplinary sanctions to be imposed for both the student who seeks medical care if they themselves are undergoing a drug-related overdose, or if a student who has a peer who's undergoing an overdose and they own substances, for them to be able to ask for help. The college environment is filled with substance use, especially as it's often a way for students to find social community with other people. And finding care on college campuses is hard. Currently at the UC, only 6 out of 10 UC campuses even have collegiate recovery programs. And these are programs that offer peer support, connections to resources, and foster a recovery culture on campuses, and do much more. Out of these programs that do exist, only 3 campuses have full-time staff allocated to these programs. Why is it on students' shoulders to jump through a million hoops, search for their own care, especially when substance use and substance overdose and asking for help are already such tolling and taxing steps? Whether it's a student's first time using a substance, or if a student meets a criteria for a substance use disorder, because there's a full spectrum of usage that exists, this bill will allow all students to stay alive, because overdoses can have dire, permanent impacts. Nearly 108,000 people in the United States died from a drug-related overdose in 2022, including from illicit or prescription drugs, according to the CDC. This number is also extremely relevant to young people, with a report from SAMHSA showing that 1 in 7 people aged 18 to 25 meet the diagnostic criteria for a substance use disorder. Among college students specifically, this number is closer to 1 in 4, which is high. Substance use disorders are also more prevalent in people of color, and the state of California serves a highly diverse higher education student population. It is essential for Assembly Bill 602 to be passed because this is life-saving legislation. Students cannot enter recovery for substance use if they're not alive to do so, and all students deserve access to the medical care that they need. I know that this issue is personal to me and personal to a lot of people here. So thank you for allowing me the space to speak today. Thank you.
Thank you so much, DT, and thank you to all of the students and leaders who are here to support this bill. We want to make this very clear. If this was you, if this was your friend, if you're a parent and this was your kid, you would want them to think about nothing else except getting help when there's a medical emergency. You don't want anyone, their friends or they themselves, to have to think about whether they're going to be punished for simply calling 911. Yet here at UC Berkeley and at campuses around the state, that's currently the reality. Students can be punished, they can have permanent discipline, they can even be expelled simply for calling for help in the middle of a medical emergency related to a drug overdose. It is dangerous. It is wrong, as reflected in other aspects of our law, including the Good Samaritan policy that exists for criminal prosecution. And I want to also be clear, a university or college can still require treatment or counseling. That can still be a part of the next steps once there are interventions. But the punishment part of this is what is so dangerous. And there's nothing in this that has anything to do with drug dealing or consequences for that, or even if a student is caught in a residential building in a non-medical emergency during where they live with substances. That's a completely different situation. We are talking about solely here medical emergencies. Young people should not be punished for doing the right thing, calling for help, whether that's the RA or 911. That is what we want people to do. And the fact that young people are being punished for it right now is wrong, it's unfair, and it's dangerous. And this bill will change that. So thanks again for all of our speakers, to all of the students who are here, to all of the students I know who also shared their stories to help bring this forward and who have had personal experiences either with overdoses or substance use disorder or with friends or family who have. This affects every single Californian. Every single city and county and part of our state is struggling with addiction and have people who have friends and family who they know personally who deserve to be seen, to be heard, to be supported, to receive care, and to not be shunned, to not be punished, to not be put into silence, particularly at these most vulnerable moments when really what they need is help. So I don't know if there's anybody here who has questions. I don't think so. Okay.
I do.
Okay.
Laura Fitzgerald with Power Radio,
Right.
Sacramento. I'm wondering if you could clarify whether this bill would just apply to public higher education institutions in the state or all higher education institutions.
It applies to, Layla's there saying it applies to all. We've talked to, it applies to also private universities?
It applies to schools.
Okay, no, yeah, I thought just CSU, UC, and community colleges is my understanding. Yeah, so it wouldn't apply to private universities, which have their own policies around things. Yeah. But not just UCs, also CSUs and community colleges, all public schools. All right. Thank you. Well, this bill will be heard in Sacramento on in the committee on the 29th. So we hope to see everyone there, and you're invited. And just really appreciate all of our speakers and all the organizations that come forward and have demonstrated such courage and leadership on this. We really appreciate it. Thank you.